have reasons why I support it partially. If you look at Sustainable Development Goals, number 3, we talk of good health and well-being. And Article 43 of the Constitution talks of right to quality health care. However, if you look at our public hospitals, they don't provide such quality health care simply because they are in deplorable state, Madam Speaker. Therefore, Madam Speaker, we must improve rural hospitals and public hospitals for that matter, Madam Speaker, because the reason we have increased mortality rate, Madam Speaker, is because our public hospitals are completely unable to provide quality health care, Madam Speaker. Madam Speaker, if you ask members of parliament, most of us go to private hospitals. Why do we go to private hospitals? It's because private hospitals have all essential ingredients, the infrastructure required to support quality health care, which is lacking in public hospitals, Madam Speaker. Therefore, in a nutshell, we must allocate adequate resources. I have a point of
order. Order, Honorable Basil, I'll come back to you. What is out of order, Honorable Sabina Chege?
Madam Speaker, I just wanted to ask whether it's in order for the Honorable Member to mislead the House that the private facilities have everything that we need. I'll urge the Honorable Member, after this session, take a drive, go to Kenyatta University Teaching and Referral Facility.
Are you informing him?
I am informing him.
So I would like to ask him whether you would like to be informed. Do you like to be informed?
Yes, she can inform me. I'm listening.
You can make it quick, Honorable
Very
Sabina.
quick, because that is the notion that is out there, that our public facilities don't have what it takes. I would urge you, and even any other member, even when you're doing your medical checkup annually, visit the Kenyatta University Teaching and Referral. We do not have such a facility in Kenya or East Africa. So we have the best, and we can even make the others the best. We can't say we will not go to public hospitals because they are in deplorable positions. We have the chance now to improve our public facilities. I thank you for agreeing to be informed.
Madam Speaker, I appreciate the information coming from Honorable Sabina Chege, but I want to tell her that Kenyatta National Referral Hospital, in theory, is a public hospital, but in practice, is very expensive, Madam Speaker. I've had bodies in that hospital who have been detained for more than 3 months because the bereaved family are unable to raise the exorbitant fees that are charged there. We have had a chance, or I've had patients from my constituency who have been unable to be cleared from that hospital because of huge medical bills. So the fees charged by Kenyatta National Referral Hospitals are equivalent to what is being charged in private hospitals. That's why I'm saying the public hospital you're talking about, these are the rural dispensaries, these are the hospitals like Kenyatta National Hospitals, where a majority of the poor are going to, and which are affordable. But unfortunately, they lack the basic infrastructure to support quality health care, Madam Speaker. Therefore, what I was saying, one, it was a mistake to devolve health, Madam Speaker. We should consider taking health back to national hospitals. Madam Speaker, it's also important to understand that the remuneration given to staff in public hospitals is waning. And that is why the staff who are supposed to serve our people in public hospitals are demoralized, Madam Speaker. We have seen them demonstrating, coming to Parliament, seeking for better pay, Madam Speaker. So it's important to underscore that. Otherwise, the motion becomes more of a theory or more of an hypothesis as opposed to being a practical motion that can apply in our country, Madam Speaker. So allow me to submit so that I can now allow other members to contribute.
Thank you very much, Member for Yata. The Honorable Kasim Tandaza, Member